Hello and welcome to another TLDR US video. Right now, nearly every state has put into action plans to loosen regulations on social distancing, with businesses starting to reopen and public gatherings beginning to return. So we figured now would be a good time to discuss the thing at the centre of the reopening conundrum: testing. The issue of coronavirus testing has been discussed quite a lot recently, but with different people claiming different things and scientific voices often being drowned out by politicians, it can be hard to get a grasp of what's really going on. So today we're going to lay out the facts as they currently are, as well as what they mean for reopening efforts going forward. And we're going to discuss the claim attached to the White House and answer, is the US really leading the world when it comes to testing? If you want more US content from us, then be sure to subscribe. Less than a quarter of our viewers have actually tapped the subscribe button, and with us now posting between 2 and 3 videos a week on this channel that are never shared anywhere else, we'd hate for you to miss out. So be sure to subscribe, and if you really want to treat yourself, hit the bell icon too to be notified every time we post a video. So let's start this examination of testing by taking a look at where we'd like to be. In an ideal situation, most people will be getting tested regularly. This of course would require a huge number of tests occurring on a daily basis. However, if this magnitude of testing capacity could be achieved, it would be incredibly helpful in showing who could return to work and who should stay at home, as well as giving government officials a better idea of what needs to be done. To get into more specific numbers, the Harvard Global Health Institute released a study a couple of weeks ago that detailed various goals that different states should be aiming for when it comes to testing. On the national level, it projects that the US needs to be carrying out about 900,000 tests a day. That said, there are other studies that estimate that the US needs much higher numbers in order to ensure a truly safe reopening. As for where the country is right now though, well, that's a less ideal situation. According to The Atlantic's COVID tracking project, the US conducted 346,094 tests on Sunday. On Saturday, the number was closer to 420,000. But zooming out, we get a better picture of the situation. And while some days show spikes in both directions, the general trend from the data is clearly upwards, with most days show a notable increase in tests from the previous day. This is certainly a good sign, and it shows that the US's testing capacity, not just in theory but in practice, is increasing steadily. That said, 346,000, or 400,000 for that matter, is significantly less than the 900,000 that Harvard recommended. And there's another catch. That 900,000 goal was supposed to be reached by May 15th, which, despite time not feeling like a real concept anymore, means that the deadline has been missed, and missed by a significant margin. And 400,000 a day is definitely nowhere near the 25 to 35 million tests that other studies have prescribed. So, in summary of the current testing rate, it's a mixed bag. Yes, the US's testing capacity is increasing, but no, it's nowhere near where we want it to be, especially considering the speed at which many states are moving to reopen. It's also especially worrying on a state-by-state level, given that Axios reported on Monday that only 10 states have met the goals that were set by the aforementioned Harvard study. The issue here is that with more relaxing social distancing rules, more and more people will come into contact with each other. This means that there will almost certainly be a spike in cases as states continue their reopening courses, a point that Dr. Anthony Fauci has often made over the last week. The spike isn't necessarily the problem though, the problem is containing it. Without appropriate testing and contact tracing, a small spike could quickly become another outbreak, which in turn could overwhelm hospitals, especially in understaffed and under-equipped areas. It would also mean that stronger social distancing rules would have to be reinstated, and no one wants to see further lockdowns being enforced because of premature reopening. The testing rate, however, is not the only thing that should be looked at when examining testing data. The other number to keep a careful eye on is the number of positive tests. This is because that number gives us a pretty good idea of how many more tests are needed. A high positive rate means that it's much harder to tell how big the actual spread of the disease is, meaning that you have to test more people. Whereas a lower positive rate generally means that you're getting a fairly good idea of where the virus is and how widespread it is. Essentially, the ideal situation is a high testing rate and a low positive rate. which would indicate that we have a pretty good idea of what's going on and can effectively monitor the disease. On the other hand, a state with low testing rates and high positive rates needs to dramatically ramp up testing. As a whole, though, the US has been moving towards the former. Data from Johns Hopkins University over the last 2 months has shown a marked decrease in the positive testing rate, while at the same time showing a significant increase in the number of tests being conducted, suggesting that the US is moving in the right direction. The final thing worth explaining here is contact tracing, and this is an issue that the US has long struggled with. In fact, many parts of the nation seemed to simply give up on the practice when the magnitude of the virus became known in March. But it's also something that now needs to be drastically and rapidly improved. Contact tracing basically goes down the list of everyone that a coronavirus positive patient interacted with during the time in which they were sick. The potentially infected people are then told to stay home and quarantine themselves to prevent further spread. Contact tracing greatly aids government and health services by ensuring that the right people are being instructed to quarantine at the right times. Tracing could be vital to a more effective and more precise response to the disease, no longer requiring millions of people to stay home. This will be especially significant as more and more places begin allowing people to come into more contact with each other, and thus increasing the likelihood of spread. Contact tracing may be great in theory, but it's less easy in practice. An effective contact tracing system would be able to notify people that have come into contact with any infected person and do so quickly, in order to prevent more outbreaks. That's a lot of things to achieve, and that's why many are advocating for a digital contact tracing system. Traditional contact tracing relies on you remembering everyone you've come into contact with and notifying them manually. But this means that people are inevitably forgotten from your list, friends you forgot you met, and strangers you sat next to on the bus that you never knew in the first place. Digital contact tracing could solve that problem, with Apple and Google proposing a system which uses your phone to automatically remember those you've come into contact with and notifying them when you fall sick. But implementing this system requires complicated tracking systems, large numbers of people, and measures that some would view as an invasion of privacy. If you want to know more about contact tracing technology, then we made a whole video on how it works and the Apple and Google proposed solution, and that's linked down below. That final issue, the one of invasion of privacy, is especially notable in the US, where there's a much stronger culture of independence from government than in other countries, especially countries like South Korea and Singapore that have had more prominent encounters with epidemics in recent years before the coronavirus. Both getting people to allow the government to track their movements and getting people to listen to the warnings when they come into contact with someone who's tested positive are going to be major hurdles when it comes to the success of contact tracing. The Apple and Google model that we mentioned earlier proves problematic too, as a Washington Post University of Maryland poll found that only about 50% of Americans were comfortable with the idea of using it, and polling that TLDR conducted found similarly low support. Needless to say, implementing widespread and effective contact tracing is going to be an uphill battle. So what does this all mean? Well, from a health perspective, it means that America is not doing great. There's not enough tests, contact tracing is still in the early stages, and no, despite what some politicians and signs might want you to believe, the US is not leading the way in per capita testing. Despite the president's claims, the US isn't conducting the most per capita testing in the world, falling behind other nations like Spain, Russia, and Australia. The US also hasn't conducted more tests than every other nation combined, something else that Trump claimed. In fact, it's not even close. And while the US has conducted more tests than any other single nation, combining the totals of Germany, Russia, and the UK beats the US total, let alone combining together the whole world's testing total. That's not to say that things aren't improving though, but when it comes to the state of testing in the US, the situation just isn't one that many experts are comfortable with. It's also worth noting here that while many are trying to compare the testing situation in different countries as a metric of how well nations are doing, it's simply not a great way of measuring things. Different countries measure testing in different ways, and plus, it's not a competition, it's an international crisis, which has to be treated as one. All of this means that most states, as well as the federal government, are going to have to ramp up their capabilities in order to keep everyone safe. But this doesn't answer any questions about reopening. The fact is that reopening is a political matter, and while public health advice can affect how politicians make their decisions, it's not always fully heeded. For now, most states are signalling their intent to move forward with their reopening plans in the coming weeks. For states with high testing capacities, low positive test rates, and advancing contact tracing systems, things will likely go fairly well. But for the states lacking these preparations, the future is looking a lot more uncertain. Let us know what you think about your state's testing procedures, and if you think that reopening should be happening where you are. And if you want to be updated as the reopening process continues, be sure to subscribe to the channel and hit the bell icon to be notified every time we release a video. Special thanks to our Patreon backers for supporting this channel and making videos like this one possible.